Dr. P.N. Sushil Kumar, MD, Siddha, PDCR, PCPB. Research Associate, Siddha, Siddha Clinical Research Institute, Safdarjung Hospital. Completed undergraduate and postgraduate in Siddha Pathology in Government Siddha Medical College, Chennai. Completed professional diploma in clinical research and professional certificate in pharmacovigilance. Worked as a medical officer in G-Care Hospital, Tiruvallur for around 1.5 years. Worked as a lecturer for around 4 years. Currently working as a research associate. Published thesis on diagnostic methodology, line of treatment, dietary regime of Thanda Gava Thumb, which is lumbar spondylosis. Published several research articles. Sir, the stage is all yours.
Good evening, all. It's happy to be a part of third World Holistic Health Day celebration. Here I'm proceeding Siddha and overview. Actually, Siddha system is a system of medicine which dominant in the southern part of India. Actually, Siddha system is not about only medicine. It is a way of life. The system provides a lot of preventive measures, and then it promotive in nature and curative and regenerative. The word Siddha is actually meaning of attaining eternal bliss. So Siddha is a continuous term. Generally we call as a Siddham. Siddham means a completed term. Siddha, previously I told you, Siddha is a way of life. It shows how to live disease-free life and attain the Sivanilai, that is attaining the God. That is the major motive of the Siddha system. So the disease are the prevention to disease are the disturbances to prevent from the human being to attain the God stage. So that is where the Siddhas are formed the Siddha system of medicine. So Siddha is not about only medicine, it is a way of life. This is 18 Siddhas. Actually, in Tamil Nadu we call 18 Siddhas are the founders of Siddha system of medicine. The first Siddha we call Agathiyar. Sivan Nandiki Solla, Nandi Emperman Agathiyarku Solla. That is the stanza we have. So it is the god from the Nandi and then Nandi to the Agathiyar. Like that the system is formed. Yeah, this is the Siddha system of medicine history. Predominantly dominant in the southern part of India, especially in Tamil Nadu. Siddha Agathiyar is the first Siddha. He wrote Agathiyar Gunavaganam, which is a Materia Medica. The lot of herbal details he gave in that. Along with that, Agathiyar Valladinari that deals with the human embryology, Karur Patti, the size of the fetus formation, and then 10th month, like that it deals. And then Agathiyar Nayanavidi means it's about eye, the diseases of the eye. And then he also extended his knowledge in the surgical instruments. Surgical instruments means small excision procedures, like that we are having 26 surgical instruments. So Agatya gave this knowledge in these books. And then Tirumular Pranayama is maximum followed in the Tamil Nadu. It has 3 steps, Puragam, Kumbhagam and then Resagam. The ratio is different, slow inhaling and then retention and then exhaling, slow exhaling, 1:4:2. In that ratio, if you did the pranayama means it will activate the Kundalini Shakti. So by that we can live healthier. And then Bogar is king of metallic medicines, we call him like that. He made a Navapashana's statue, which is in the Palani Murugan temple, and he is well versed in the metallic preparations. And then Pambati Siddha has more knowledge and explained in the Nanji Murimarutham, that is antidote. And then Yugi pathology only we are maximum studying. He derived a lot of diseases basically on the clinical signs and symptoms. Along with that, he is also expert in alchemy. And then Siddha Pinyanuga Vidhi, we call as a Pinyanuga Vidhi, that is preventive aspect. What are all the do's and don'ts? He explains clearly in that. What are the food we have to eat, what are the food we have to avoid, and which time we have to avoid, which position we have to sleep, like that he is explained. And then he is also expertise in diagnostic methods. Siddha has its unique diagnostic method called 8-fold examination. That is Naniram, Modivili, Malamutiram, Nadis Parisam, Ivayanathum, Maruthurayam. So that means these 8 are the weapons for the physician, like that the strengths are described. These are all the basic concepts of Siddha, Vadam, Vaidyam, Yogam and then Jnanam. Step by step it's come. Vadam means turning small items into high metals, like that, and then Vaidyam, that is medicine oriented, and then Yoga, it maximum deals with the posters, and then Tirumala Pranayama, I don't know, that all comes under this, and then Jnanam, and then we are having a lot of philosophical 96 Tattvams. It has 3 subdivisions, Sutta Tattvam, and then Asutta Tattvam, and then Siva Tattvam. All are Siva Tattvam is 36, in which the chakras, 6 chakras will come, and then Sutta Tattvam, Anma Tattvam, that is 30. And then the short form it means Siddha medicine, we will have a major principle of 5 Bhudams, 6 Suvais, and then 3 Mukkutrams. So Panjabhudangal, Arusuvai, and then Mukkutram. Depending upon that Bhudam, Andathil Ullade Pindam, Pindathil Ullade Andam, we will have one poem. That means whatever is present in the universe, we are having all in the body. So depending upon that 5 elements, we are for the drug choice itself, depending upon the 5 Buddha therapy, we are doing that. This is 96 Tattvams. I told about that Anma Tattvam, Siva Tattvam, and then Asutta Tattvam. Arivu is the one Tattvam which controls all the other Tattvam. Arivu means knowledge. Okay, I told about Vada Pitta Kapha, generally in Ayurveda we will tell. We are having the same in the name of Vadi, Aral, Ayam. Panjabhudam I told no, that 5 basic elements. Vadi, which has air and then space, and then Alal, Pittam, fire itself, and then Ayam, Man plus, that is earth and then water. Vali almost movement oriented, and then Alal on the digestion oriented, and then Ayam is mucus, and then liquid oriented. Along with that, Panjabhudam, Arusuvai, and then Mukkutram, we are having another 7 Udal Tadukal, 7 Udal Tadukal, Saram, Sennir, Oon, Koluppu, Enbu, Mulai, Sukkila, Shwanidam. The all saram nourishing. Next slide you can see the action. Yeah. Nourishing fluid, it gives the nourishment to the body, and then blood gives the nourishment to the muscles, and then muscle, it gives the shape to the body, and then adipose tissue, this gives lubrication for the joint, and then bone, which gives strength, and then sperm ovum responsible for the reproduction, nervous tissue imparts strength and endurance to the bone. These are all the 7 udal tadus. Therapeutic principle. Previously I told 8, we are having a unique diagnostic procedure, 8-fold examination. Along with that, how we can use that means Poriyal Aridal, Pulanal Aridal, and then Vinadal. So Poriyal Aridal means by using the sense organs, and then by examining the patient's sensory function, and then by interrogations. This is the 8-fold examination I previously told. Along with that, Manikadai Nool, Manikadai Nool is another diagnostic procedure. 4 finger breadth we can first measure, and then we group up what are all the diseases, come to that wrist circumference. Okay. According to Tirukural, Beginum, Kurayinum, Noi Seyum. So 3 humus, if it is increased or decreased, that will result in the disease. Tirukural itself it was described. So how to neutralize the Mundru Tadukar. So if you neutralize that Vada Pitta Kapha means, then the disease will be free. So therapeutic purgation is the method to normalize the Vadam, and then therapeutic emesis is used to normalize the Pittam, and then therapeutic nasal drops, and then Coryllium normalizes the IM. Vamanatal Viresanatal Vadam Talum, Vamanatal Pittam Talum, and then Nasi Anjanatal Kavam Talum. Okay. By drug choice also we are having the basic Panchabuddha theory. Which udal tadu get affected means the opposite udal tadu, opposite Panchabuddha we will give to neutralize that. And then another principle is food itself a medicine. For Siddha, unave marinde, marinde unavu. For the Siddha, Sattva, Raso, Tamogunam. 3 types of food we are grouping up. Sattva, Raso, Tamoguna means depending upon that food we have that characters. Next slide we can see that. Yeah. Sattvam somewhat peaceful oriented, and then Raso is medium, and then Tamo is gives somewhat anger, like that, some bad qualities like that. Sattva food generally vegetarian oriented it will come. Then Pasumbal milk like that it will come. This is the food chart. Okay. If you want to neutralize whatever food we are eating, Sattva, almost we are not able to use the Sattva food. Sometimes we can take Rason and Tamo means. These are all the 8 common used kitchen products which will neutralizes the 3 humus. That is cardamom, cumin. Cardamom is used for sweet oriented, and then garlic, poondu perungai, masopotida will use it for the dal vagera tuberous item to neutralizes the doshas, and then pepper and turmeric also use it for the sweet lifestyle management. I don't know, it is not about a system of medicine, it is having it describes the way of life. So Nalulkam describes which time we have to wake up. Brahma Muhurtam, 4 o'clock early morning we have to wake up means that is good for oxygen. So brain will actively work like that, it will have, and then south direction only we have to sleep like that. And then season, according to Tamil, six is another Kargalam, Pudirgalam, Munduvenir, Ilavenir. So in this time we have to take this type of tasters and avoid this type of tasters. They will describe like that. So that will have then all these things have to neutralize the Vali Alal Ayam. And then seasonal regimen also describes the Pinian Gavidi, Paul and Boom, drink warm water after buying. Only that is advisable, and then 2 times taking food is normal, and then 1 time is rogi, 3 times is bogi, like that. And then buttermilk we have to take by only dilution, and then take sufficient quantity of cow's milk, like that. Pinian Gavidi there describes Nasiam 45 days once we must have to neutralize that, and then oil bath every once in a 4 days, that is weekly twice we have to take, like that. And then sleeping position, left lateral position is advised. Like the same, what are all the opposite things? Padinam Vegangal, natural just, urination, defecation never has to suppress that. And then day sleep we have to avoid. And then after never smell fragrant flowers during midnight. Like that, I advise which are all the things not to be done. And these are all the general outlines, the branches of Siddha medicine. Pharmacology means Gunapadam, and then we are having own Nanji Marutvam, toxicology, and then antidote for all the mineral materials. And then pathology, which describes the Noinadal, which describes the Siddha pathology. General medicine, OBG, we are having pediatrics, surgery, dermatology, ophthalmology, we are having this amount of branches. Drugs. According to the disease, if the diagnosis we came by that Siddha diagnostic method means 8-fold examination and then Manikanayun, the choice of drug will be under the SOI basis. So, along with that dietary regimen we will give for the each and every patient. We are also having the patient-centric method of treatment. Same like that, almost we are having the same 3 origin of drugs: herbal based, mineral based, and then animal based. Purification, some question was arised during the previous session or in the morning session, I am not able to recollect, whether some of the patients having allergic reaction, chronic kidney oriented, if you are taking herbal medicine for a long time means kidney oriented disease will come, the question, we are having a Sutti Murai, all the drugs including the herbal we are using in the system of Siddha system of medicine, we are purifying them. So that is the one process. If the purification was done in a perfect manner means then there will be no impurities in the final finished products. We are having 32 internal medicines and then 32 types of external medicine. I am going Sar Surasam. Majorly we are using Kada third point. Ministry of AYUSH suggested a national distribution of Kabasura Kudinir for the COVID. Along with that AYUSH-64 tablet, they suggested a national distribution of Kabasura Kudinir in the pandemic, so that gives more attention to the Kabasura Kudinir Kada. And then some higher order medicines will be there: Parpam, Chenduram, Mulu, Katte, Kuligai. External procedures, we are having 32 type of external procedures. We are maximum using Tokkanam, Pugai fumigation for piles, like the patient we are doing that, and then incision, leech therapy was we are doing in the Tamil Nadu for almost all the physicians who are having a single setup clinic also, they are doing leech therapy. Okay. Some of the other strengths, Varma therapy. Varma therapy we are having specialized, and then Tokkanam. Tokkanam is for Vada oriented disease. These will give good results. And then Odivu Murivu, bone setting. Traditional bone setting methods are more common in the southern parts. And then regenerative therapy, Kayakalpam, and then yoga. These are all the special trends of the Siddha. Varma, we are doing in Sabdajang Hospital, we are having a Siddha clinical research unit there. We are conducting OPD there. We are having therapy there, cervical spondylosis, lumbar, and then periarthritis, and then OA. We are doing Varma points. By activating the Varma points, we are relieving the diseases. Along with that, hormonal disorders, we are managing through the Siddha system of medicine. Diabetes, insulin dependent diabetes, we are having a patented drug D5 Churanam, CCRS. These are all the research activities done by the Central Council for Research in Siddha. In GIMS Noida, we conducted one double-blinded study which gave a good result. As a single line of therapy, we are doing for stage 1 hemorrhoids and then diabetes in the moderate level like that. As an add-on therapy, we are doing for the disease. And then parallel in south, where every government setup, whatever patients coming for chronic disease means they will refer for the Siddha system. So we will give oil like for the oil like that, and then Varma points we are activating. These are all we are doing there. I thank to the Director General CCRS for giving this opportunity and the organizers of the World Holistic Health Day. Thank you.
And any questions in the audience?
Siddha is same as a Tibetan therapy. Tibetan therapy is different.
What's that?
Tibetan people, they also do.
No, sir. We are having our own history through Agathir. Agathir belongs to Agathir described all in the Tamil. So we are having southern. We are limited to southern. We are having traditional in the southern parts of Tamil Nadu, Sri Lanka, and then wherever Tamil people is there, we are using the Siddha system. It is not having any relationship with the Tibetan.
Thank you, sir.
With this, we come to the end of this session. I request Dr. N.K. Gupta to do the honors for the speaker as the chairperson. Okay. Dr. Sushil Kumar.